Using the VAS score. Now, there's a multitude of different ways to actually do this. The VAS score normally is directed at a scale of showing a frowning face, so a pain face, all the way up to the happy face where obviously there's no pain. Most of us within the industry, we use that term, but we actually use a numerical based system from 0 to 10 or 0 to 20. Overall, what you're trying to gauge is the patient's perceived or subjective pain. So throughout this strain count, strain positional release course, when we're asking you to gauge the patient's pain at that time, normally we're asking between 0 and 10. Sometimes it'd be a good idea to show the patient before you start the numerical score that you are looking for. In obvious circumstances, you never want to go to a 10 out of 10 of pain, purely because that is 100%. So when you are looking for that pain scale, when you are treating, probably never go over a 7 out of 10. That would be quite high anyway for the patient. You're just looking mainly for when you put the patient towards a position of ease, that scale, for example, starting at a 7, now goes down to a 3, 2, or even a 1. And then you'll hold the patient into that position of ease for between 90 seconds up to 2 minutes. Then you will take them through other techniques that will increase their quality and quantity of movement. Just remember that VAS score is subjective, so it will vary from person to person, but you're there just to gain an understanding of how much discomfort you're giving the patient to make sure that you can make the technique as effective as possible.